I was asked to talk today about a gluten-free and dairy-free diet and the effect on proteinuria. So in 2015, in the Pediatric Research Journal, there was one article that has reviewed this topic and has found some interesting correlation with the gluten and dairy-free diets. So if we take from 1977, there was one study that has studied steroid-responsive nephrotic syndrome in children, 6 children. They put them on liquid elemental diet. And interestingly, 3 out of 6 patients, they went into complete remission. And later on, when they have reintroduced cow's milk, they have again showed some relapse, and they have again improved on a milk-free diet. And this was something very interesting at that time. Then later on, around 10 years later, there was another study which was looking at idiopathic nephrotic syndrome, and they have put 13 patients on oligo-antigenic diet for 10 days. And they have also found some improvement with this diet. In all 13 patients, proteinuria was significantly reduced. And they have also found that there was a history of allergy in 8 out of 13 patients. Then the next study on this was with cow milk protein, and they have taken 17 children with steroid-resistant nephrotic syndrome. They have excluded cow's milk from the diet, and 6 patients went into remission. And then later on, after remission, they have given them again the cow's milk, and they have again showed relapse. So this has clearly showed some correlation, however, not in all of the patients. Now, the next study was on primary IgA nephropathy and the effect with the gluten-free diet. So in this study, 29 patients were put on gluten-free diet for at least 6 months. And they have found that IgA-containing circulating immune complexes levels were significantly decreased after 6 months on the gluten-free diet. And they have also checked IgA levels to the gluten antigens and the bovine and egg antigens. And they have found also that they were higher before unrestricted diet, and they have the levels were decreased after the gluten-free diet. And the mean levels of IgA to most of the dietary antigens have also decreased on a gluten-free diet. And the proteinuria level has also decreased. Now, all the previous studies were done in the 70s, 80s of the last century. And then for almost like 20, 25 years, there was not too much investigation done in this issue. And recently in 2018, there was one trial announced in which they wanted to put nephrotic syndrome children, steroid-resistant nephrotic syndrome children in a summer camp, put them on a gluten-free, dairy-free diet. And when this study became realized, they were able to enroll only 16 children. And 2 of them has showed reduction in the proteinuria. And so it was not like a breakthrough, something very impressive result. But I will just, in a few minutes, I will explain it more why. So if we check IgA nephropathy and the association with the gluten, then we found that from 1987, it was already described that in the IgA antigliadin antibodies, they have some association in the IgA nephropathy. And it is also known that gut-associated lymphatic tissue, it plays a major role in the development of IgA nephropathy, which was also shown in genome-wide association studies. So in a study in 1989, they have measured these IgA anti-gliadin antibodies in 45 IgA patients, 34 membranous patients, and 31 idiopathic nephrotic syndrome and membranous-proliferative glomerulonephritis patients. And they found that around 50% of the 53% of IgA patients had these antibodies, and very less percent of the other nephrotic syndrome patients had these antibodies. So they have also proposed that this would be a good predictive blood test that could predict that this patient might have IgA nephropathy. So interestingly, in 2018, recently, there's a new thing that came up in a pilot study. They have tried medication, which is budesonide, which is entry-controlled release, and it directly acts on the Peyer's patches, suppressing the gut-associated lymphatic tissue activity, and in IgA nephropathy patients. And they have found that with this medicine, there was a significant reduction in the proteinuria and the stabilization of the renal function. So this also proves that there is some relation between the gut and IgA nephropathy. Now let's go and talk about gluten-free diet. So this, what is this gluten-free diet and from where it came from? So if we check, for example, in the USA, what are the diet trends? That there was always some fashion in the diet, like low carb diet, and came the fat-free diet, and then from 2008 onwards, the gluten-free diet became very popular. And what we see in this, that initially it maybe started by a scientist, but then later on it was picked up and marketed by the food industry, because now if you say anything is written gluten-free, then people are much more likely to buy it. And the other thing is that there is always some culprit, like we say, okay, the carbohydrates are bad, so you have to eat low carbohydrate diet. Then came, okay, no, the fat is bad, so you have to eat the fat-free diet. And now came, okay, no, gluten is bad, causing all the problems in our lives, so you have to be gluten-free. But they are just too much superficial, because we just pick up one thing on the diet, and that may not be adequate. Now let's see, what is this gluten is about. So gluten is the main structural protein of the wheat, and it also comes in others like rye and barley. And the main proteins in that are the gliadins and the glutenins, which are the toxic proteins. And if we see a gluten allergy is an immune-mediated response, it's an allergic reaction, which a few people will have. But if you see gluten intolerance, is just like inability to tolerate gluten, is also immune and also non-immune mediated. And gluten sensitivity can be a mixture of both of these. And we know only one disease which is directly induced by the gluten, that's a celiac disease, which is an autoimmune disease affecting the small intestine. And they have also recognized there is also a silent celiac disease, which means that the antibody testings will be negative, but the patients are reacting to the gluten. And what are the symptoms of gluten sensitivity? It can be very non-specific, like some GI symptoms, fatigues, depression, skin reactions, weight loss, autoimmune disorders, all kinds of autoimmune disorders, joint pains, and neuropathies. And basically, recently it was also proposed for the classification of these gluten-related disorders, autoimmune, allergic, and non-autoimmune. And in this one, lots of disorders come. Especially in the autoimmune, we know celiac disease, gluten ataxia, dermatitis, herpetiformis, and they can be all symptomatic or silent. And in the gluten sensitivity, well, which is very non-specific, and in the wheat allergy comes all the respiratory allergies, food allergies, contact urticaria, but they are the allergic types. Now, in 2009, Dr. Alessio Fasano has published one very interesting concept, which is known now today as Leaky Gut Syndrome. So it proposed that there is a protein called zonulin, and this zonulin gets released when the gluten enters the gut. So in the enterocytes, zonulin gets released, and zonulin will open up the tight junctions in between the cells. And that's why what we are eating and what we have in our gut, and that includes non-digested or half-digested proteins and other nutrients, they can cross the barrier and they can cause immune reaction, which in people who have the tendency for autoimmunity, it can induce autoimmune disease as well. And if we see what is zonulin, zonulin can be measured in the blood. It is actually a pre-haptoglobin 2. And this is a key biological effect of zonulin, is to open up the tight junctions. And what we see is that in most of the autoimmune diseases, we can measure high zonulin levels. And because of this, they have also tested one medication, which is a zonulin inhibitor, trying if it could help in the treatment of autoimmune diseases. And this is all under investigation currently. So today we have also talked about obesity. And that's why it's also interesting that they have also found that in obese patients, these zonulin levels are a bit higher, and they are nicely correlated with all the risk factors of the metabolic syndrome, and body mass index, waist to hip ratio, fasting insulin, triglyceride level. So there must be some connection, but we still can't see it very clearly. But if we talk only about gluten-free, dairy-free diet, then what we are looking at is just the tip of the iceberg, because the main thing is that what matters is more like the quality of the diet and not just one or two aspects of it. Most of the diet, we have lots of very popular diets, but most of them, they just focus on one type of macronutrient, like low protein diet or ketogenic diet or carbohydrate free diet. What we are picking up is just one macronutrient, and we are only focusing on the macronutrient. But if we would focus on the micronutrients and the quality of the diet, then we could realize that there is much more importance, because all the plants, the vegetables and fruits, they contain all the vitamins, antioxidants, the phytonutrients, which our body needs. And if we don't give our body what the body needs, then we cannot achieve the good health. So if we see what are the triggers of the leaky gut syndrome, it's not only the gluten. It can be all types of other things like dietary proteins, and all other toxins, hormones, stress. And if we see leaky gut could lead to food intolerances, immune abnormalities, and later an autoimmune condition, which means that it's like a spectrum of diseases. So there is a new kind of trend, which is called the functional medicine. So if you see like you have a patient with lots of symptoms, but all of the blood tests are normal, all of the investigations are normal, then you would just label it, okay, it's a functional, like functional dyspepsia, functional pain, because we cannot really catch it, and the disease has not progressed as much that we could diagnose it as a specific disease. So that's why functional medicine started to investigate these and found that there are actually root causes for all of the diseases. And this functional medicine has a textbook, which can get us nearer to this. So, for example, if we see autoimmune diseases, they have lots of factors where we could find the root causes for them. Before, we used to, in our medical books, we used to learn that autoimmune diseases are just like, we have no idea why they come. And the only thing what we can do with them is to suppress them with the immune suppression. But now there are more and more evidence that actually there are causes of these diseases. There can be root causes that can be found. And if we address all of these factors, we can even reverse the autoimmune disease without immunosuppression. And if we look at the factors, and one is genetics, which we already know. The other is the food and nutrition, which includes food intolerance, leaky gut, dysbiosis, and food additives, and especially deficiencies in the nutrition. If we look at the toxins, we have heavy metals, pesticides, plastics, electromagnetic fields, and then we can have infections, parasites, chronic sinusitis, dental infections, asymptomatic abscess, caries, root canal problems. And then we have to mention psychological and mental factors. So all these factors, they contribute to the autoimmune disease development. But to talk about these in more detail, I would need, I think, at least another 1 or 2 days of lecture, and I cannot do it in 20 minutes. But one thing is sure, that I have, when I have a patient with nephrotic syndrome, then I try to, or even briefly, I try to go through all of these and try to find if they have any occult infections. So I do a paranasal sinus screen, I do a dental screen, and I had many patients who came with a membranous nephropathy, and I found they had sinusitis. I cleared the sinusitis, and they went into remission. Another patient, I look in the mouth, and I see there are lots of bad tooth. So I said, go to the dentist, clean up your teeth. And after cleaning up the teeth, she went into remission, and she's still in remission without any immunosuppression. And the other, heavy metals. In some patients, we found high mercury levels or high cadmium levels with membranous nephropathy. And when we have eliminated the source, they also went into remission. So it's not always that we have to jump with the immunosuppression. We can see a little bit if there is any other causes. And thank you very much.